Today's topic of discussion is gangrene. What is gangrene? Gangrene is necrosis. Necrosis means uh, tissue death of tissue associated with super added putrefaction. Putrefaction meaning decomposition of dead tissue. So, gangrene is a necrosis of tissue associated with super added putrefaction. So, gangrene is equal to necrosis plus super added putrefaction, decomposition of dead tissue. Here we know 5 different type of necrosis. Any 5 type of necrosis will occur here. There are 2 main type of gangrene, dry and wet gangrene. These wet gangrene have special type, that name is called as gas gangrene. These dry, here no or few bacteria. Okay, it causes super infection. Tissue, that bacteria get attracted towards this dead tissue. So, dead tissue remain dry only. So, it have that name dry gangrene. Here no or few bacteria. So, here what will happen? Bacteria not get liquefied, dry condition only. Second one is wet gangrene. Bacterial super infection here. Okay, here abundant number of bacterium. Here no or few bacterium. Here abundant number of bacterium. So complete death tissue by liquefied bacterium. Bacterial super infection gas occur. So here bacterial super infection will occur. Here abundant number of bacterium is presented. So here what will happen? A liquid mass wet. So biggest difference between dry and wet gangrene. Here no or few bacterium. So that dead tissue remain dry only, but here liquefaction, liquid mass wet. So that reason only it have that name wet gangrene. In all type of gangrene, necrosis undergo liquefaction by that action of putrefacious bacterium. By that action of putrefacious bacterium. First, we will discuss about dry gangrene. It occurs mostly distal part of a limb. This one occurred distal part of limb, toes and fingers, feet, toes and feet. It is occurred due to ischemia, blockage of artery. Arteries supply that part blocked. So, here due to this blockage of artery, ischemia formation, that part of body not getting pure blood. So here not getting pure blood, so it causes coagulative necrosis. Part of body not getting pure blood, so it causes coagulative necrosis. Ischemia of all part except brain. Okay, so here there are very slow development. So very slow development. Here this artery blocked, not getting pure black. This part necrosis happen, then putrefaction is happen. Then the line of separation between dead tissue and viable tissue. So we can find out that line of separation between here, this one is the affected one, this one is the normal one. So line of separation between dead and viable tissue. So we can make out complete clear cut line. So the line of separation is possible in dry gangrene. It is a type of coagulative necrosis due to blockage of artery. Then crossly affected part is dry, stringent, and dark black, resembling the foot of a mummy. Foot of a mummy. What is the reason of black color? Why it will producing black color means affected area RBC ruptured due to liberation of hemoglobin from hemolyzed RBC. Few bacteria present that released H2S, hydrogen disulfate, resulting in that formation of black iron sulfide. So hemoglobin bacteria producing hydrogen disulfate producing black iron sulfide. So second type of gangrene, wet gangrene. Here abundant number of bacterium is presented, not few bacterium, abundant. Bacteria superimposing everywhere in the death tissue. So necrosis, liquefactive necrosis. That's why it is known as wet gangrene. Usually occur in moist tissue and organs, bowel, lungs, mouth, cervix and vulva. It is occur due to obstruction of venous as well as arterial blood flow. So here obstruction of venous as well as arterial blood flow. It is very fast development, not clear line of demarcation. There in dry gangrene, separate line between death and viable tissue. Here not clear cut line of demarcation. This one also fast development. Classical examples is gas gangrene of the bowel, commonly due to strangulated hernia. Then diabetic food is an example of wet gangrene injury, okay, in that food. Diabetic food, hyperglycemia condition, blood have high glucose. Whenever abundant of glucose in blood, bacteria will be more. Bacteria get attracted towards glucose. So bacteria high means wet gangrene, liquefying condition. Crossly affected part is soft, swollen, dark black color. So now difference between dry and wet gangrene. Putures, site, distal portion, mainly lymph. This one bowel and moist area. Mechanism in dry gangrene, artery occlusion obstruction. Here the blockage of both venous and arterial. Then crossly or macroscopically organ dry, stringent and black color. Here moist, soft, swollen and dark. Then here bacteria very few only presented. Here numerous abundant bacteria are presented. Then putrefaction limited due to very little blood supply. Here putrefaction is abundant because bacteria is abundant. Then line of demarcation here present at the junction between healthy and gangrenous part. Here not absent. Here no clear line of demarcation. Then prognosis relatively better. This one is poor. Next, gas gangrene. It is a special type of wet gangrene. Why special? Increased bacteria. This bacteria, gas forming bacteria. Example, Clostridia. It is a gram positive bacteria. Um, this one gas forming bacteria. That's why it is called as gas gangrene. It will producing gas. A person have road traffic accident, so he fell down on the road. There was a soil, so he got injured over on time. In road soil, spore of bacterium is present, so the spores of that bacterium will enter to necrotic tissue. So the bacteria will grow inside necrotic tissue. It form gas bubbles. Okay, it form gas bubbles. So it is called as gas gangrene. This gas look like a balloon. Okay, balloon like feel. Full gas presented. So grassly swollen, edematous, painful, crepitant. So in this video we discussed gangrene necrosis plus putrefaction. Two type of gangrene, main types, dry and wet having gas gangrene. Here that line separation between death and viable tissue is presented, but wet gangrene not presented like that. No clear cut line of demarcation. Then different between wet and dry gangrene. Then last one is gas gangrene. This one we will touch here. Inside no solid and liquid, only gas only presented. Thanks for watching.